Welcome everyone to the Cultivating Compassion Education Series, sponsored by Compassionate Care ALS. We're delighted to have with us today speaking about genetic ALS, embracing preparation for potential futures with Jean Swidler and Cassandra Haddad. Genetic ALS and FTD and the Legacy is a nonprofit foundation created by and for families impacted by inherited ALS and FTD, frontotemporal dementia. The founders believed there was something missing for this group within the ALS community. They wanted to create a place for people going through genetic ALS and FTD to connect and be united in their common ground. Jean Swidler's mother, grandmother, and great-grandfather, aunt, and uncle died of ALS caused by the C9orf72 expansion, and she is at risk of the same fate. With others, she formed Genetic ALS and FTD and the Legacy, and is its current executive director. Cassandra Haddad witnessed her mother, uncle, and grandfather die of SOD1 ALS and dedicated her career to helping others as a nurse practitioner. She has pioneered efforts to bring medical care to the at-risk community and leads a network of clinical sites offering an approach to care called the Genesis Network as part of her work with Temple Neurology and End the Legacy. So welcome to both of you, and also welcome to our founder and CEO, Ron Hoffman. Welcome, Ron.
Yeah, thank you, James. And Jean, Cassandra, thank you for being here. Everyone who's here, thank you for showing up as well. This is such an extraordinary topic, and this has touched so many people's lives. I met Jean, I believe it was at the Niels conference last year. I saw her speak, and I was really taken with, obviously, the subject matter. I was a caregiver for a man named Gordon Heald in 1997, so I've been in the world of ALS for a while. I met Dr. Brown, I guess in 97, 98, and of course, back then, I came to learn he discovered the SOD1 gene in 1993, which was the, first gene linked to inherited ALS. Now, of course, I think there's close to 40, if not more. So it's extraordinarily complicated for those not just living with ALS, but those who may or may not have inherited a particular gene. And it is so incredibly complex. And after, meeting Jean, it's like we should put something together because this is information that I'm certainly not expertise at. And the group that she's put together, I'm just incredibly fond of and love what it is that they're doing. So Jean, welcome. Thank you. I turn it over to you. Cassandra, thank you for being here.
Well, thank you so much, Ron and James and the Hall Compassionate Care ALS community. And I'm going to be sharing two different little presentations before Cassandra talks about some of the nitty-gritty medical stuff. So my first slides are going to be about my family and our experience with ALS. So this photo is of my grandmother, Lillian, my brother, James, and my grandfather, Bernard. Pictured in 1990. She was suffering from ALS at the time, and she passed away just a few months after this photo was taken. My grandfather worked very hard to make sure their not disabled friendly home was comfortable for her, including by adding an elevator to their wood home. So there was a lot of dedication there, and I was a small child. I was about 7 in 1990, and I remember it feeling quite overwhelming for me. After my grandmother died in 1990, there was very little need to be talking about ALS anymore, it seemed. This is a photo of many of Lillian's descendants, not all of them, but many of them in circa 2011. I have many of the photos covered, except for my dad and my mom and myself and my grandfather. Um, the ALS did come up because my mother would talk about it a lot. She was very anxious about developing ALS. Her 50th birthday was a few years before this photo. And I remember being at a celebratory dinner for her 50th birthday, and she talked a lot about developing ALS and her fear of that and not wanting to get it and that sort of thing. And I didn't quite understand the context, and no one else would really talk about it in the family. Then at a certain point, things changed for my mom. She started having trouble moving. In 2016, I got married in sunny Oakland, California, and she had trouble walking to the dock that we got married on Lake Merritt. And she was not sure exactly what it was, but she had trouble walking. She actually stepped on my dress. I had both my parents walk me to down the aisle, and since she had trouble walking, she stepped on my dress. And nobody fell, but she was having some troubles there. And then a few months later to that, she fell at work and really got rattled, and finally got referred to a neurologist. In her neurology session, she shared about her mother who had ALS, and then she also shared about her grandfather who had ALS, who I either didn't hear about or did not quite put the pieces together about. But that was what was driving my mother's anxiety, was that she had seen two generations die of ALS before her. She had nerve damage in both her feet, and the doctor ignored her insistence that it was ALS and diagnosed her with peripheral neuropathy unexplained and sent her on her way. Over the next many months, she continued to decline despite working very hard at the exercises. And of course, myself and other people in our family and friends all would tell my mom, well, the doctor excluded ALS. This is a good thing. But she was getting worse. This photo on the right here was after she had been released from the hospital after falling and breaking her hip, which was a consequence of her having trouble walking. And following this, she had trouble getting off the walker from the hip surgery. The hip surgeon did not like that. They want their patients walking, but I guess they don't account that some people might be becoming paralyzed for other reasons. And then she started having trouble with her hand. You can see even in this photo, her right hand is atrophying already. And she had trouble writing. And then she started getting bulbar symptoms. And finally, in October 2017, she was diagnosed with ALS just 10 months after her first neurology visit excluded it. This photo on the upper left corner was soon after my father moved my mom into an apartment. My mom saw, I guess, that putting all the equipment into the old wooden house did not do much for my grandmother. So she decided to just move into a wheelchair accessible apartment. Pictured with her are some of her siblings and spouses and my dad, not all of her siblings, though. So that was about October 2017. By this photo in the middle was April 2018. So just 6 or so months after that. And you can see she's in that wheelchair. She never walked again. So she moved very quickly through ALS progression. And in the photo on the bottom right is Thanksgiving 2018, excuse me. So that was just about 1 year after diagnosis, and she was very, very advanced. And she finally passed away in February of 2019, having lost all communication ability and basically being totally paralyzed. So about 16 months after diagnosis and probably 2.5 years after very clear symptoms had emerged. And sad to say, ALS was not done with our family. That photo that we shared on the last slide with some of her siblings, 2 of them have since passed away from ALS. My aunt and my uncle. So my mom had 7 siblings make it to adulthood, and now 3 of them have died from ALS in 7 years. So I just wanted to close the presentation about my family with just some questions. Did my mom's ALS journey have to be like that? And many of us thought maybe not. Maybe it did not have to be that way. So we are Genetic ALS and FTD and the Legacy. So we created this group. So we offer support, advocacy, education, research, and care for the genetic ALS and FTD community. Our mission statement is that the genetic ALS and FTD community is large and growing. ALS and FTD are terminal conditions, and being at a heightened risk for them can have profound impacts on people and families. So we organize genetic ALS and FTD and the Legacy to provide educational and support resources to encourage and promote research about and advocate for the genetic ALS and FTD community. And we work in partnership with the ALS Hope Foundation. So just to dwell on the concept that the genetic ALS and FTD community is large and growing, many of us might be aware that ALS and frontotemporal dementia have significant, if minority, autosomal dominant genetic populations. Autosomal dominance means that the inheritance can come from just one parent. So you don't need both parents to have a bad variant for the child to inherit it. They just need to get one gene from their parent. So you see disease throughout generations. And in both of those diseases, the share that you see that in that, generation after generation of disease is there, but it's not a majority in either disease. But this can obscure that a large population of people who are walking around healthy are asymptomatic gene carriers. And we know that there must be these people like myself and like Cassandra and many others walking around to allow for the repeated cases of genetic ALS and FTD that occur each year. Just through some back of the envelope calculations, you can easily arrive that there's at least a few 100,000 asymptomatic C9 carriers in the US alone. And if you're curious why we talk about ALS and FTD, the C9 mutation is linked to both diseases. And currently, there's no real way to say whether anyone who's carrying that gene and healthy would develop one, the other, both, or neither. And with more genetic testing, more families know their risk. And these are photos of some of our community members with their family members with disease. And just to illustrate that each genetic case of these diseases leaves others at risk. So we set out to provide resources like we talked about: care, education, support, research, advocacy. Cassandra is going to talk about the care. So we need to make sure our community's voice is heard when our families are discussed. There's things that our families need, and those in power need to hear about those things. For example, where having a dedicated voice for the genetic ALS and FTD community can be very important is in politics or legislation. For example, right now, we're trying to make sure that genetic protections are furthered across the country, both federally and in states. It's looking pretty good in California. So if you're Californian, that's a good thing. But we would really love to see nationwide protections for genetic discrimination. We also need to make sure our community is heard in public discussions about our families. For example, very recently, the New Yorker magazine published a story using very flawed analysis, linking C9 or 72 repeat expansion carriers to crime, and dangerousness based on one person with that mutation who committed some crimes. And we were able to push back on the reporter and make them amend the article. So that is another area where our community needs to make sure we're getting our voice heard. And of course, also when people in the academy, the lovely researchers that we all appreciate, are talking about our families, then we should have some say in what's being said about us or how it's being said. And we do love research. Many of us are very active participants in it. And we know that the road to curing ALS and FTD is through research. So we ensure that members of our families know what research there is to participate in. A little note on this. We've had, before we came online, there was no collated source of studies that people impacted by these genetic diseases could participate in. So we had members of our community travel from Texas to Boston on their own dime to go to a genetic research study in Boston when they did not know there was a genetic study in Texas that they could have been going to. So by collating those studies all together, people are now more easily empowered to see what might be around the corner from them to participate in. Another angle on this that we work with is ensuring questions of importance to us, but no normal research community has answered yet, get answered. For example, we've surveyed our community to get thoughts on pre-symptomatic care and interventions, and we've contributed to the discussion about these things. And we also make sure to participate on advisory boards and committees to ensure research is responsive to our needs. Because if people are researching you, they really should be thinking about what your community thinks about things rather than just assuming that they know best. We also want to make sure that our community has education. Now, there's a lot of wonderful resources for ALS patients and caregivers and families, and FTD patients and families and caregivers. But the questions and the interests that people who are impacted by genetic or inherited disease can be a little bit different. And the questions that people might want to ask about different topics might be different as well. So we make sure that there's a space for this in webinars, social media, written resources on our website, flyers. We've also seen that there's a barrier to receiving genetic counseling in many places. So we provide genetic counseling education, which is where we work with a genetic counselor to just make sure people understand what they're getting into with genetic testing and counseling, but it's not medical genetic testing or counseling. And we're very proud to offer that. And then, of course, support. So we knew we needed to create a place to be with others who know what it's like to be impacted by this. Because not just anybody does. And those of us who are impacted by genetic ALS and FTD can share that it's kind of awkward to talk to your friends about this. And even amongst your family, not everyone wants to talk about the disease that's in the family. So finding other people who are impacted and want to talk about it can be a very valuable thing. So we have peer support spaces. Those are spaces where there's no agendas, just sharing from people's experiences. We also have community team meetings. And these are regular working meetings where we discuss the news, plan different projects that are going on, that sort of thing. But of course, you're getting to see other people impacted in this setting and understand that people are living their lives and engaging with it. And it can normalize being in this position. And we're very excited to talk about also our in-person summits. We've had 3 to date, and we have 1 coming up in September. And these are the only places outside certain family reunions that those impacted by genetics will be the majority in a room. Just wanted to plug briefly our 2026 North American Summit This photo in the upper left is the group photo from our 2025 summit, which was in Philadelphia with the ALS Hope Foundation. Down below, you can see a lineup of our speakers. We're a few months out, so that might change a little bit, but as of right now, that's who's committed to come. We're doing this in partnership with the ALS Network in sunny Sacramento, California. It's going to be from Thursday, September 24th, midday through midday, Saturday, September 26th. It is restricted to people who are impacted in some way by genetic ALS and FTD, although we look at that expansively in terms of if your spouse was impacted by this, if you're at risk for this, that sort of thing. If you have active disease impacted by genetics. We make sure that the barriers to come are low. So for a small registration fee, we cover folks' hotel for the 2 nights of the meeting, and we cover all the meals and the full conference experience just for that small registration fee. And we hope if you are impacted by genetic ALS and FTD, you consider coming. And if you know anyone who's impacted, that you'll share this opportunity with them. So again, that's our group in a nutshell. There's a lot of ways to be involved. If you would like to be interested, you can email us at info@endthelegacy.org or look through our website at endthelegacy.org. If you want to email us and share how you might want to be involved, you can be on our meeting list. So those are our community team meetings. Those are twice a month. You can be on our newsletter list, which is where we collate news just 4 times a year. And if you're able, we'd love to have you come to our summit. And of course, you can follow us on the usual social media channels. So I will stop there. Thank you all for listening so politely. And we did not talk about one of our pillars, and that was care. And that's why we're going to pass it over to Cassandra.
All right. So good afternoon, everyone. Thank you for having me to speak today. I'm Cassandra Haddad. I am a family nurse practitioner, vice chair of End the Legacy, and I'm living at genetic risk for ALS due to an SOD1 variant. So for many years, families like mine were told that there was nothing to do until symptoms appeared, and today that is no longer true. So I'd like to spend the next few minutes talking about how we're transforming care for people living at genetic risk from uncertainty and isolation to education, monitoring, and hope. So I know it's really hard to hear our family stories, but this is my family, and I need you to know that I am okay. I tell this story a lot. I'm very comfortable with it. So we have 8 at least documented generations lost to ALS in my family, and today there's 2 of us living at risk. So growing up, ALS wasn't a rare disease. It was part of every single generation of our family. I lost my grandfather, Harold, in 1990 before our gene was discovered. And then things were really quiet for a really long time. And so my mom and her 3 siblings kind of thought that nothing was going to happen. And then in 2019, my uncle Dwayne developed leg weakness. And he was the first person to have genetic testing, and it was discovered that we have SOD1A4V, a particularly aggressive and highly penetrant gene. He was able to enroll in the VALOR trial for tofersen, what we now know as Qalsody, but due to COVID, his trial site was actually shut down and he rapidly progressed and died. The day he died, my mother's symptoms started, and she convinced herself that it was all in her head. But unfortunately, it wasn't. So we raced to get her the very last spot in the same trial, VALOR, but it was too late. She missed the last spot, and the doctor who qualified for us always felt really bad about it. And so he and I worked together to make sure that she was able to get tofersen through the expanded access program. Bloomberg did a nice story on our family, and they were able to confirm for me that she was the very first person in the country to get that dose of expanded access tofersen. And she did okay for a little while, but unfortunately with our specific gene, tofersen is not a miracle cure. We did have her for 25 months, which is the longest that anyone in our family has ever lived with ALS. So we are very thankful for that. During my mom's illness, I also had genetic testing done. And found out that I am a genetic carrier. And like I mentioned earlier, A4V is really highly penetrant, meaning that in all likelihood, I will develop ALS as well. My children are too young to be tested, but each child has a 50-50 chance of inheriting the gene. So up until recently, for 8 generations of our family, the only option was wait. Wait for symptoms, wait for weakness, and wait for a diagnosis. I thought that we deserved more. So a few years ago, I wrote an email to several providers, including Dr. Terry Hyman Patterson. And not only am I a nurse practitioner, but I have a kind of unique skill set. I am a director of clinical operations, and I'm really good at building and scaling clinics. So I thought, what better contribution could I make to my own community than to have our own clinics? Eventually, that email would grow into a collaborative effort involving clinicians, researchers, advocacy organizations, and families, which I'll talk about in a little bit. So Dr. Terry replied to my email and she said, "Hey, I love this idea. We're going to have a meeting about this very topic. Come to this meeting and we're going to get this figured out." And Jean and I were both very fortunate to be at this meeting. And this was really the first iteration of any type of guidelines for our families, even though the first gene was discovered in the very early 90s. So there were many, many years of nothing being done, but this was the start, right? So dare to begin. We had to start somewhere. And so this was the very first time that an international consensus group came together and they agreed with us. People at elevated genetic risk should have more advice than just wait for something to happen. This was a major milestone. And although there wasn't really anything earth-shattering in this paper, it did recognize that people at high risk deserve care and should be offered care in specialized clinics, and that we really need to individualize care based on their age, their gene, their family history, and as the community, we always say based on the patient preference as well. Talked about routine neurological examinations and monitoring things like neurofilament light chains, about ongoing counseling and support, not just one-time counseling, and really about treating patients and families, about connecting people to research and using shared decision-making for surveillance. So this was a major philosophy shift, that people living at pathogenic risk should no longer just have a wait and see approach. So instead of saying like, when are people going to get sick? We're asking, how can we connect people to care? How do we monitor them safely? How do we prepare them for prevention therapies that are on the horizon? How do we support people emotionally while enabling them to continue to live very full and very healthy lives? The goal is not to medicalize healthy people, but to ensure that no family faces ALS alone or too late. So this is all really exciting stuff. But what do we do with it? So this is what I'm the most excited about, is taking this guidance and moving it into the clinic and into changing lives of patients. It can't just be words on paper or ideas. This has to be care for our families. So Dr. Terry and I started at Temple University clinic through ALS Hope. And so what we started doing was implementing the clinical guidelines, providing education about prevention studies like all ALS, using biomarkers and monitoring such as EMGs, and supporting flexible surveillance that respects patient preferences. So every family's needs are different. Some people want more monitoring, some people want less, but really it was about shared decision making. So some of our patients come in and they want to be seen to kind of get a baseline when they first find they're at risk, and then they don't want to come back for a little while, and that's okay. We have other patients who have known Dr. Terry for many years through subsequent generations of their families being in clinic, and they want to be seen every 6 months. So really it's about individualizing it to that patient and that family. A little bit about how our clinic works is their first point of contact is our nurse, Mary, and she talks to them to make sure that they understand what it means to enroll in care from a privacy framework and a genetic discrimination framework. We're very fortunate in that we have a genetic counselor that will then meet with patients. And then patients will come in and see Dr. Terry and myself. They get a full neurological exam. We do monitor NfLs, and we often order EMGs as well. So as exciting as all this is, I knew this was a really, really big idea and that our clinic at Temple can't possibly see hundreds of thousands of people because that's the true number. So how are we going to do this if we're not going to do it alone? And how do we make it so that every single clinic doesn't have to reinvent the wheel? And that's how the idea of Genesis was born. So Genesis stands for the Genetic Education Network for Early Symptom Identification and Support. The whole idea is to connect clinics together and share what's working, what's not working, what's the latest in guidance, how can you implement this in your clinic, and do we have resources to share? Genetic counselors aren't plentiful, right? And some clinics have more money and funding than others do. So how can we make this work all across the country? So our goal is to have a connected network of clinics and hopefully someday even expand beyond our country to include the whole wide world. So we're still working on sustainability and funding, but I can honestly say this is the most exciting thing I've ever done in my life. And it's growing quickly. So we started with one center and we're already up to 6 all over the country. We're very thankful to our partners who have wanted to be recognized by End the Legacy as providing culturally competent care and who all want to work together to provide the best care we can without duplication of efforts and really just trying to optimize how are we going to do this for so many people. So we have UCSF, Northwestern, University of Minnesota, Temple, Mass General, and Nova Southeastern, and probably more on the way in the near future. And most recently, Jean and I met again with experts from all around the world to update those consensus guidance just in May. And this meeting had a very different feel. So the first meeting was really brainstorming ideas, and this meeting was taking that to the next level and really drilling down into what this guidance actually means, what does it look like, what information can we give patients and families, and I was really just blown away by how candid and respectful the conversations were, how much the community voice was respected and appreciated and asked for, and really the shared purpose in that room was palpable. So those guidelines have not been released yet. They're still under voting, but I'm really excited to see where those go to help lead us in clinic to provide the very best care for our patients. This science is evolving rapidly. There's new information coming out on new genes and biomarkers all the time. And the treatment landscape is changing as well. So the clinical guidance is going to have to evolve along with it. So this will definitely be a living document that will continue to grow. And I'm really excited to see what happens next with it. So that's my mom, and that's my kiddos when they were little. They're twins, and they are 9 now. And in that heart is the many, many people who passed away in my family from ALS. So as I finish, I just want to leave with one final thought. For generations, our families have inherited ALS, but we're building something different now. We're building knowledge, resources, community, earlier care, and with all of that, hope. Because ultimately, it's not about guidelines and clinics. It's about making sure no family walks this journey alone. So for every family and for every future, thank you so much.
Do you want to shout out Kate and Elaine, our folks that we've chatted with before? So glad to see you guys.
Yep, welcome.
I just wanted to comment that it seems that we all have like numerous cases and numerous generations of having the disease, and it's taken such a long time for it to start to be taken seriously. Last Thursday, I was on a Zoom session with a genetic counselor and a genetic neurologist, and the doctor had pulled my family file from 30 years ago from the University of Alberta Hospital archives. And so, like I say, it's taken that long, 30 years. Only 15 years ago, in my case, the mutated gene was discovered.
So, yeah, I have a question for Jean and Cassandra, because I don't know. And if someone is able to connect with one of the clinics, what does that look like? Alrighty. So I walk in, my father had ALS, I have a gene. What happens? How does that conversation unfold? What is that conversation? What is that? What does that look like?
So one of the very best places to start is people kind of come in two different pathways. And one is they've already been tested and they know that they carry a genetic variant, or they know that they're at risk for a genetic variant and want to know what does that look like? Should they be tested? What are the risks and benefits of being tested? How will it impact their lives, their insurance, their jobs, their children? How do you have these conversations with your family? How do you know what's right for you? And so I'm very, very thankful that there's an amazing genetic counseling community that can really help walk each person through that decision-making process and ask the big question of, is this a good time for you to make this decision, right? Because we all know life's real crazy. And we can all look back through what us and our own families have gone through, and we all kind of have like the worst of the worst stories because it seems like in this disease, if something's going to go wrong, it does. My mom did not have genetic counseling, and it took her 6 months to get her test result because her family doctor botched it and then
Mhm.
told her, good news, you only have one copy. So I've seen firsthand just how important genetic counseling is to really help you navigate that. So when someone comes into clinic, they haven't always been tested yet, which is, kind of changes things depending on the pathway you come in. So if they haven't been tested yet, we talk to them about how to get genetic testing and what's the best path forward to do that. So if they're coming in before genetic testing, it's usually because they have a symptom they're concerned about. So one young lady, Dr. Terry had taken care of her grandmother, and she was having numbness and tingling in both hands. And we know that that's not primarily an ALS symptom, but it's a very worrisome symptom to you when you've seen people in your family have ALS. Same thing with fasciculations or muscle twitching. So we were able to talk to her, get an EMG, very quickly reassure her that she had ulnar neuropathy, meaning she was damaging her elbow nerve from leaning on it. So here's a plug, don't lean on your elbows. Um, but we were able to reassure her that she did not have ALS at that time and then offer her genetic testing. And the two big pathways to do that are you can do it through the clinic. It does go into your medical record, and there are laws that say that that has to happen. The other pathway would be to enroll in research. And if you enroll in research such as All ALS or Prevent, then you can have access to genetic testing that doesn't go into your medical record. So just really helping people navigate. It's like a twisty, turny decision-making tree that'll be different for you and for me, and that's okay. We have to make it work for you. But then our clinic visits, people get a head-to-toe, really nice neuro exam by Dr. Terry. Um, she's been in practice a very long time, and each of the clinics that are on board have ALS neurologists. So they aren't general neurologists, they are seasoned ALS neurologists to really do a thorough exam. And then at our clinic, we do order NFL, so neurofilament light chains, and we do get EMGs on a pretty regular basis. There's a big question saying how often should these things be offered, and no one really knows that yet. That's an area that I'm working really hard on with Dr. Terry, because really that's going to be super personalized, not just based on your gene, but the subtype of your gene and sometimes even your family history. So, for example, someone with a FUS mutation may need to start care very, very young, whereas someone with a C9 mutation, for example, may end up entering into care later, maybe even their 40s or their 50s.
I would think the elephant in the room, because in my experience, anyone diagnosed with ALS, that diagnosis, the traumatic experience, in my opinion, that is, the elephant is mortality, right? And where's the support, after people receive that diagnosis, walking out and all of a sudden their life is flashing before him? I can only imagine, folks with, a particular gene mutation, that's an incredibly huge piece as well. Not just watching their family member navigate this, but all of a sudden, that's huge. That's incredibly huge. And so that's the piece that I always find intriguing and always grapple to find support for individuals willing to navigate that. Because again, that's the big elephant that's in the room there.
This
So,
is this is Jean here, and I'm so sorry my internet seemed to be spotty, so I went off camera, but I'll still speak with the camera off. We're happy to be a place for people to come and at least see that other people are going through this and intuit that if they can speak to other people about it, that life doesn't end immediately when you find out these things, and to at least share from similar experiences. I think also can be instructive for people to think about their relative who, exposed them to this information. Like in my case, my mother getting sick and dying when she was in her latter 60s. That is as you think that through with a genetic counselor, if you're in your 30s and your parent got sick in their 60s, that can be something that can help put it into context for what you might be going through. But of course, it's very individualized. Sandra, I don't know if there's anything you want to add to that.
I was just going to say, I think for the genetic community, the anticipatory grief is something that I think is unique and very understudied. There's also a what we've seen in a little bit of research that has been done is there's really a period of grief followed by a period of integration where we integrate this into our lives. And for many of us, we do become advocates. But I think even knowing, that it is a fatal disease, what we've seen within our own group is people getting diagnosed so much earlier that they can make radical changes, whether it's involving in clinical research or just making decisions about what they want the rest of their life to look like. So despite having a known genetic risk, people still have a very long diagnostic delay. So anything we can do to shrink that diagnostic delay is going to be really important.
Nice. Thank you.
thank you, Cassandra and Jean. Susan, go ahead. I'm going to go with Susan first. I know there's several people with their hand up, but Susan, go ahead and ask your question.
Thank you. My mom died in 1990 from ALS, and I have a gene mutation from her. I'm 74. I was diagnosed in April. Are there any new medications coming forward for someone with a gene mutation?
Suzanne, I'm so sorry to hear that. 1990 seems like it was a bad year for genetic ALS, with my grandmother, Cassandra's grandmother, and your mother all passing away in that year from ALS. And I'm so sorry that you got diagnosed. For Cassandra mentioned this, but two of the genes that are associated with ALS that are more rare, there are treatments that are either newly approved or looking pretty good. That's SOD1 and FUS. For the most common gene mutation that there is, C9orf72, there's not any.
That's what I have, C972.
You're in good company. That's what my family has.
Oh, thank you.
Sorry that you're suffering from it as well, but I'm glad to hear that you're in your 70s, because that's always good to make it to a good age. And right now there's drug trials for general ALS, and basically any treatment for general ALS is theorized to work for C9. So totally keep your eyes on that. And there may be other approaches that come online for C9, and I know there's some other people who might speak about some of those things. So thank you, Suzanne. Glad to be
I'm
connected.
hopeful and excited, and I had a miracle on June 26th. My voice came back better with pronunciation, and my tongue is less swollen. And I know God took care of that.
Go ahead and unmute.
Hi there. My mother had ALS almost 40 years ago, and she died in her early 50s. And now I'm in my early 60s and was recently diagnosed. And I'm concerned for my daughter. My genetic testing is still outstanding. But how do we tap into the sort of the genetic counselor network so that my daughter can get some support?
I'm sure your daughter is thinking of you most of all. I know when my mom was sick, I did not want to talk about my risk at all because I just wanted to think about her. But it's very nice. It's family, and you're thinking about the family. So, uh, did you have genetic counseling as part of your testing?
Not yet. I'm with the local ALS clinic, and the genetic testing is pending through Invitae, and I go back to the clinic towards the end of this month. We're hoping to have the results at that point, and then I'll discuss with the neurologist at that point.
Can I ask what your clinic is?
The Duke Clinic.
Oh, Duke will have genetic counselors on tap. So you should feel free to be speaking to them about that. But if your daughter's interested in research, she can join a research study basically anywhere in the US. There's a study, and
She's already joined the Prevent study, and I'm part of the Assess study.
oh, that's great. Well, and through the Prevent study, there is genetic counseling available if people want it. So, and congrats. I'm glad you guys are doing it.
Thank you.
Summit. We'd love to have her if she wants to come, and you if you're traveling. But
Thank you.
Bridget.
Hi there. Thank you for holding this session. I would have to say I must be a newbie because I feel like I'm hearing language that I don't even understand. My husband passed away from ALS 3 years ago. Ron, I don't know if you remember, you were instrumental in getting him diagnosed with FTD just prior to his passing. And up until then, we didn't know there was any genetic link, and he was in the military, so we declined genetic testing for him. But his brother has since been diagnosed, who is 7 years older than him. There is a history of Alzheimer's in the family, which was known. So now I'm looking at my children who are 17 and 19, and just at those beginning stages of like, oh boy, what do we do with this 17-year-old boys that are really not interested in pursuing this path, but I'm sort of trying to educate myself and recognize that early intervention and education is kind of critical. So I don't really know if I have a question so much, but if there's any thoughts on this when, I don't have a genetic connection except obviously with my children. My children do. And at a young age, it's just a whole different ballgame of like getting them aware, given this sort of these two cases that are not generation after generation for our family.
well, I'm so sorry to hear about your husband and his brother. And I'm sorry that you're in the position to worry about this, but there's no easy answers about this, especially in the context of these diseases that are more for middle age or older, mostly. And some of our community members have written about talking to their teens. Not everyone talks to their teens about this. I didn't quite realize my mother knew that she had two generations before her, and she didn't really explicitly tell me about it until she was sick. So, that was just my experience. But if you're thinking about it a lot and talking about it a lot, I think also society is moving more towards not hiding things. But there's easy answers here. I don't think there's any one right answer there.
Right. Well, thank you for this forum. I appreciate it.
Good to see you, Bridget.
You too, Ron.
Yeah, where are we? Kathy.
Hi, my name is Kathy Brastow, and I have the C9 gene. When my sister was diagnosed in April of 2021 and died in October of 2022. She had bulbar symptoms that just really progressed very quickly, and she died. When I get diagnosed, I was asked if I had anybody in my family that had ALS. And I said, yes, my sister. And my neurologist asked me if I would go under genetic testing. And I said, sure. So about 3 months after I took the test, I went back for my follow-up. And then I found that I had the C9 gene. After discussion with the geneticist, and she asked me about my family background, I told her my mother had dementia and she was in a nursing home and died. And she had personality changes. And my mother's mother, who I never met, was in a mental institution. So they were pretty much sure that this gene came from my grandmother. My daughter was in on this genetic testing session that we had over Zoom, and she knows that, she has a 50% chance, but she's not willing to do any of the testing.
Well, I'm so sorry to hear about your diagnosis and your sister's, and the impact that the gene may have had on your family. And yeah, of course, for young people, it's their decision to figure it out. And like I mentioned, many of us want to make sure our ill loved ones know know that all our attention is on them. Um, Often in these situations. So thank you for sharing.
Thank you.
Thank you, Kathy. Kate.
Hi. For those that are newly diagnosed with C9orf or SOTI or any of the genetic, that is your window from when you're first diagnosed to about 2 years to 3 years, and where you'd be eligible to be in any of the clinical programs. After you get to a certain amount, they kind of put you, unless you're in a study that will continue, they'll there'll be ones you won't be into the active studies in the Healy platform. I do know that there's one drug that's in the Healy platform that I was a part of the initial study, and I was the only genetic patient in it, and my ALSFR score went up high. So there is possibility for C9. It just may not be right here. When I was first diagnosed, I knew my father had FTD, and I went about going through when my uncle, his brother, was diagnosed with ALS. I knew it was genetic. Went through, got into the all FTD and the LFTDS thing. I knew I had C9. When symptoms happened, I advocated for myself. Since then, I have my genetic letter, and any family member that has been diagnosed since, there's been 3 others in my dad's generation. My 2 daughters, one was in her mid-20s when I was diagnosed, and she saw the FTD in her grandfather. And he had behavioral onset, which is, something that a lot of those of us that have seen FTD or seen the ALS, what it looks like. And it's scary for people, especially when they find out that they may be at risk for it. My oldest was 26, and she wanted to see if she could get tested. And knowing that GINA protects some things, but it won't protect other insurances or that. I'm glad there's work on getting more privacy for that. But she was told that, if you don't have symptoms, don't get tested. There's nothing they can do for it now. My 7-year-old, who's now about to turn 14, because I am the longest living person in my family with C9 with ALS. I haven't brought it up to her. Until she has questions, I've had her and, we've talked about the ALS. There's been different groups for pediatric for talking about it. But why do you want to put that horror on them that young? When kids are teenagers, when they have questions. I've shared my genetic letter with every family member of my dad's siblings, so if something happens, they've got that, and that's actually helped. So once you get diagnosed and you talk to your genetic counselor, usually they offer to give you a genetic letter, keep that. And if you have a family member that starts having symptoms or you notice symptoms, you might want to share that with them. But I was wondering about the genesis, and I'm hoping that can come here to Houston. But is that the genesis? Is it covered under insurance for these people that may think that they are at risk of developing a familial ALS? Oh, that's awesome for Baylor. Okay. Thanks,
Yeah,
Jean.
so the insurance piece is kind of tricky. When you enter into clinical care, you are putting things into your record. And there are a lot of laws governing what has to go into your record now. I see genetic discrimination in two ways. One is it's been a fear that has held people back and clinical care back for a really long time. And I'm not trying to undermine the importance of changing those laws. But I think sometimes the fear of something is bigger than the potential repercussions. And I don't think that should be a barrier to care. But at Temple, what we do is we just run through people's insurance. And it's a specialist copay. Usually there's a diagnosis code that we use, like fasciculations, but there is an ICD-10 code for genetic risk of disease. So that's oftentimes the one that we use. And then whatever people's copays and things are for blood draws and EMGs, although oftentimes we'll try and pair it with prevent so that those EMGs are covered. The problem with research, though, is that you don't have disclosure of your biomarkers back to you in almost all research trials. So if you're like me and you want to trend your NFLs, you do need to get those done privately. But yeah, the insurance and the cost of care piece is a very real concern.
Yeah, thank you, Kate. So last question, Elaine.
Hi, I live in Edmonton, Alberta, Canada, and in this province and city, I was told that when I get my genetic test results this upcoming Thursday, it will not be put on my medical record, nor will they tell my family doctor, and that they will tell me on a Zoom session and then follow up by mailing the information to me, which is a good thing. So it's totally under my power on who I tell, if I tell anybody else. And I think this is important for us to look across Canada and the United States and how each of us are doing things differently when it comes to legislation, so that at what times we can lobby to make changes made to legislation, and we can use examples and say, well, here and here and here, they do it this way, and for me, this is really made me happy that it's not going to affect insurance or anything else, healthcare or that.
Thanks, Elaine. I just wanted to flag that Dr. Pfeffer was at the meeting Cassandra and I were at. I don't know if he's the doctor you're working with, but I know he's an ALS doctor in Alberta.
Who?
Dr. Pfeffer, Gerald Pfeffer. Don't worry about it.
Okay.
Wonderful. Wow. Well,
I think one other thing, Ron, Jean, you mentioned in the chat that you were talking to Baylor about putting a clinic in there. Is that correct?
The doctor there was at the Target meeting that I was at too, and she said that she's very interested in this sort of stuff. We haven't quite pinned it all down yet, but it seems like they are interested in that. So, good lead.
Good, yeah.
Beautiful. All right. Will, quick question, bud.
Thank you. Sorry, I really wanted to attend this. I have one question. I've been diagnosed 20 years ago, in 2006. Back then, I got tested for SOD1, and that was it. 20 years later, I did one test, genetic test, but that was maybe during the bucket challenge in 2017. My question is, how many genes or new genes have they discovered, and would it benefit me, since I've been sporadic all the time, to get tested?
That's definitely a case-by-case basis. The doctor as to what genes were on the 2017 test, because were funny things over the last number of years where the largest gene that's contributed that does not have a specified therapy yet, C9, wasn't on all the tests until pretty recently. So that might be one thing to look into. But other than that, there have been some new genes identified, but they're all very rare. So the odds of them coming up a hit are increasingly unlikely, but I'm sure your care team would be willing to look into that with you.
Okay, thank you.
Thank you, Will.
Oh, I have one more. So I did miss a bulk of it. Will it be on YouTube or on the council website, Lauren?
Yeah, this will be recorded, Will. This will, you won't, we'll have it next week. Okay?
Oh, perfect. Thank you.
You're welcome.
Good to see you, Will.
Wow. Well, I have one thing, and then I'll turn it back over to James to close out. To Cassandra and Jean, thank you so much. Your knowledge and wisdom are incredibly important here. I'm going to make sure my team watches this, our senior care liaisons in particular, because these are questions that come up. To be able to point them in your direction is so incredibly important. So I really, really thank you for what y'all are doing in a very big, big way. Incredibly important. So thanks for being here.
Well, thank you so much for giving us the chance and for those kind words and everyone for sharing. And I really appreciate it and really feel privileged to have been a part of it.
Yeah. Okay. All right, James.
Yeah, thank you, Ron, and thank you, Jean and Cassandra. Really valuable, very informative, and and I think it's important that this aspect of ALS not be on the sidelines and become mainstream and understood and appreciated, because it really is a very serious thing. And so we appreciate you coming to be with us. And just remember, everyone, we're accumulating quite a asset on our website with our educational library with such a wide range of topics being covered. So please visit ccals.org and go down to resources. You'll see our educational library, and it's quite a resource. So share it with your friends and family, people who want to know what's going on. So with that, thank you everyone for spending time with us. It's always great to be with you, and we'll see you next time around.